Bharatiya Janata Party-led Modi government is coming up with National Health Policy 2017. The last National Health Policy was framed over 15 years back in 2002. 2017 National Health Policy aims to increase public healthcare expenditure to 2.5% of GDP, with more than two-thirds of these resources going towards primary healthcare. The policy is expected to bring healthcare for all, to all corners of the country, particularly the underserved and underprivileged. Highlights of National Health Policy 2017. Public health spending in National Health Policy 2017 by Government of India is to increase from 1.4% of GDP to 2.5% of GDP. The total amount is a whopping 3.5 lakh crore rupees. A little over 2 lakh crores will be allocated to primary health care so that its benefit reach every nook and corner of the country. India has over 5 lakh plus villages and hope they benefit from National Health Policy 2017. Government of India's Primary Healthcare Policy 2017 will be through a brand name called Health and Wellness Center, which will include care for major non-communicable diseases, mental health, geriatric healthcare, palliative care, and rehabilitative care services. What will this National Health Policy 2017 achieve? What are the targets and what are the projections? The target is to provide 2 beds per 1,000 population, which means 25 lakh hospital beds for 125 crore Indians. To reduce cost of medical treatment, government will provide free drugs, free diagnostic and free emergency and essential healthcare services. The National Health Policy 27 targets to increase life expectancy by 2.5 years in next 8 years, from present 67.5 years to 70 years by 2025. The National Health Policy 2017 will look for reduction of total fertility rate to 2.1 at national and subnational level in next 8 years, that is by 2025. The government expects to reduce mortality rate of children under 5 years of age to 23 per 1,000 in next 8 years, that is by 2025. The National Health Policy 2017 expects to reduce maternal mortality rate to 100 in next 3 years, to reduce infant mortality rate to 28 by next 2 years, reduce neonatal mortality to 16 and stillbirth rate to single digit by next 8 years. The Government of India expects to kick in Make in India umbrella policy for easing hurdles for manufacturing of drugs and devices. The Government of India will bring new medical education system which will be graded to meet challenges for sourcing millions of healthcare professionals required for serving 25 lakh hospital beds in India. There will be an increased demand for mid-level service providers like nurse practitioners, public health cadre, availability of healthcare professionals. Now the reality check and the challenges. Until 2014, only 11.3% of registered allopathic doctors were working in government hospitals in India. The rural penetration is even worse. The challenge is to provide more healthcare professionals for primary care in rural areas. Availability of trained doctors and nurses would help meet the new infant mortality and maternal mortality goals and build on the gains from higher institutional deliveries which exceeded 80% in recent years. Presently, the private sector provides 70% of all outpatient care and 60% of inpatient treatment in India. So public and private partnership is the only option left, as capacity building in government hospitals will take time. But then new challenges will come, like accountability, quality and cost of care provided by private sector health services. There will be an added challenge to provide robust and up-to-date health sector audit, which is required to get robust health data. Inputs from multiple sources and sample surveys are not compatible and so not comprehensive. The biggest challenge for Government of India will be the provisioning of essential medicines and diagnostic tests free of cost, which will reduce overall cost burden to patients. National Eligibility cum Entrance Test, or popularly known as NEET exam for entrance eligibility in MBBS and BDS seats conducted by CBSE has seen 41% jump in application. In 2016, there were 8,02,000 applicants who appeared for NEET exam. This year on May 7, the NEET exam for undergraduate admission in MBBS and BDS courses for admission in medical and dental colleges will see 11,35,000 students appearing for the exams. This is more than 41% increase in application from previous year. NEET exam will be conducted in 103 cities across India. The NEET undergraduate exam for medical and dental entrance test is conducted every year by Central Board of Secondary Education, or CBSE. In a significant development, Medical Council of India has agreed to remove restrictions of age ceiling and number of attempts for sitting for NEET exam. In a resolution passed recently by the Medical Council of India, the previous restrictions such as 3-attempt limit and age ceiling of 25 years have been done away with. Presently, the NEET exam is conducted in 10 languages: Hindi, English, Gujarati, Marathi, Oriya, Bengali, Assamese, Telugu, Tamil and Kannada. Central Government and Ministry of HRD is contemplating conducting exam in Urdu next year. What is life skills? The term life skills refer to the skills you need to make the most out of your life. It is associated with managing and living a better quality of life. Having a good life skills allows you to accomplish your ambition and live to your full potential. Essential life skills. There are infinite number of life skills you may need at various stages of your life. Depending on your life circumstances like your culture, belief, age, geographical location, etc., you will need various types of life skills. For example, when at school or university, you will need study skills. When buying a house, negotiation skills may be needed. You will need to work on your employability skills to get a job. When you have a job, leadership and presentation skills may be useful, along with a whole host of other skills. When you start a family, you will need parenting skills. Also, time management and organizing skills are likely to become important. Let's find out some of the major life skills required in day-to-day life. Personal skills are the essential life skills you need to help maintain a healthy body and mind. How you recognize, manage and cope with emotions is an important attribute of yourself. Interpersonal skills are the skills we use when interacting directly with other people. We use both verbal and non-verbal communication techniques when engaged in face-to-face conversation. Literacy, reading and writing skills. Most people communicate at least some of the time using the written word through letters, emails, reports, text messages, social network feeds, and a whole host of other methods. Being able to write clearly and concisely is a very powerful way to communicate, either one-to-one or to much larger audience. Numeracy skill or number skills. Developing or refreshing your numeracy skills or number skills can give you a real boost in life. Better numeracy skills can make you more employable. It will help you to develop a better understanding of the world around you, save you time and money, and improve your mental health. There will be times throughout your life when you will need conflict resolution, stress management, and problem-solving skills too. Perhaps the most important life skills is the ability and willingness to learn. By learning new skills, we increase our understanding of the world around us and equip ourselves with the tools we need to live a more productive and fulfilling life, finding ways to cope with challenges that life inevitably throws at us. Life skills are not always taught directly, but often learned indirectly through experience and practice. Airline companies in India are on a high. Domestic Indian flyer numbers have gone past 100 million tickets sold. India now stands third after replacing Japan in total number of domestic air traffic flyers for the year 2016. Now India is behind USA at top, where 719 million passengers fly within the boundaries of USA. China is placed second, with domestic flights accounting to 436 million passengers there. In terms of overall air traffic passengers, both domestic and international destinations included, India now enjoys fourth position with United Kingdom. Indian overall flying list is expected to become third by March 2018. In overall flying list for any country air traffic, USA's combined air passengers stand at 815 million in 2016. Second in the overall flying list is China with 490 million passengers, and Japan holds third place in overall air travelers passengers traffic list with 141 million air travelers in 2016. The open sky policy by Modi government has eased transport and traffic through air route, and massive reduced air passenger ticket pricing has facilitated more air passengers in India. Short journey and long haul journey by train in India is the most preferred form of travel. On year growth, Indian domestic air passengers traffic has consistently clocked 20 to 25 percentage point increment. बीजेपी के त्रिमूर्ति उत्तर प्रदेश में योगी आदित्यनाथ is Chief Minister Designate of Uttar Pradesh. He will have services of two Deputy Chief Minister in Keshav Prasad Maurya and Dinesh Sharma. Keshav Prasad Maurya is BJP President in Uttar Pradesh and Dinesh Sharma is Mayor of Lucknow. 1972 born Yogi Adityanath is 5-time Member of Parliament from Gorakhpur. His ancestral home is at Pancher village in Pauri, Garhwal. He is a BSc graduate from Garhwal University in Uttarakhand. Yogi made his parliament debut after winning election in 1998 from Gorakhpur. Yogi Adityanath is chief priest of Gorakhnath temple in Gorakhpur. Yogi Adityanath is Chief Minister Designate of Uttar Pradesh. 1969 born Keshav Prasad Maurya is from Kosambi district. He has contested 2002, 2007 and 2012 assembly elections and was the sitting MLA from Sirathu Assembly constituency before getting elected as MP from Phulpur seat in 2014 with a thumping 5 lakh votes and over 52% votes. He was appointed BJP's chief of Uttar Pradesh in April 2016. Maurya's fruit of labor was because of consolidating non-Yadav OBCs for BJP that was instrumental in BJP winning 300 plus seats. 53-year-old Dinesh Sharma is National Vice President of BJP. He is academic by profession and is professor at Lucknow University and is also the mayor of Lucknow. He is young upper caste face of BJP in Uttar Pradesh. Dinesh Sharma was instrumental in BJP membership drive and took BJP's membership in Uttar Pradesh from 1 crore to 11 crore. Three musketeers of BJP have been selected to rule Uttar Pradesh and make it Uttam Pradesh.